Hi everyone. Today's presentation is about best practices of fall prevention brought to you by student pharmacists from Notre Dame of Maryland University School of Pharmacy. My name is Jay Patel, along with my fellow classmates Craig, Carmen, Princess, Lauren, Joshua, Emmett, Janine, and Marlene. Here are the learning objectives that will be covered throughout the presentation. At the end of this presentation, you should be able to identify some of the most common causes of falls, identify categories and a potential inappropriate prescription medications and over-the-counter medications that can cause falls, discuss and understand why sleep is important in preventing falls, identify and discuss personal medication record, also known as PMR, and why it is important, define osteopenia and osteoporosis and identify their common risk factors for bone loss. Last but not the least, identify common ways to strengthen your bones with exercise and nutrition. Here are some of the most common causes of falls. Tripping over objects, such as carpet, furniture such as stool, chair, sofa, wires, or basically items laying on the floor in places where you're commonly walking. Medication can be one medication or multiple medications that we'll further discuss in an upcoming slide. Alcohol. If you drink alcohol, it is important to consume moderate alcohol consumption because drinking in excess can cause falls. The recommendation for the guideline is that male do not consume more than 2 drinks per day and female drinks no more than 1 drink per day. Poor lighting, such as in elevator, stairs, hallways, room, bathroom, or basically anywhere you are commonly walking or living. Uneven surfaces, such as walkway when you are walking outside, unsafe stairways, such as stairs without rail guards, blood pressure or blood pressure medications that you are taking. For example, sitting down on a chair for too long or laying down in front of television for too long and then getting up suddenly, you might feel dizzy and feel like you're going to pass out because at that moment you might be experiencing a form of low blood pressure that can make you fall. If you experience that, you want to push yourself on a bed and give some time for blood pressure to adjust for some time before getting up. Next, we have footwear, diabetes. If you have diabetes and have weakness, numbness, and pain from nerve damage, usually in the feet, you may want to wear appropriate footwear to avoid falling. Last but not the least, weather, such as ice, rain, or slippery surfaces. So you want to wear appropriate footwear and use caution when walking in these weather conditions. Here are some of the most common medications that can cause falls. Anti-anxiety medications such as alprazolam, also known as Xanax, diazepam, also known as Valium, and lorazepam. Antipsychotic medications such as haloperidol, chlorpromazine, perfenazine. Next, we have antidepressant medications, amitriptyline, doxepin, nortriptyline. Next, we have anticonvulsant medications such as gabapentin, phenytoin, or phenobarbital. Blood pressure medications such as clonidine, pain medications, meperdine, oxycodone, fentanyl, morphine, and tramadol. Next, we have sleep medications, zolpidem, also known as Ambien, antimuscarinic and anticholinergic medication, oxybutynin, dopaminergic medications, trihexyphenidyl, and benzotropine. If you are on any of these medications, you want to use caution. If you have any questions or concerns regarding this medication that you are taking, that maybe you're taking, you can always ask your pharmacist or doctor for questions and help.
Over-the-counter medications. I have them, you have them, but what do we really have going on? When you look inside your medication cabinet, what do you see? You may see some valerian root or melatonin, or maybe some cough syrup. But what do these all have? These are all things that are going to make you pretty sleepy. And when you're sleepy and you're still awake, you have an increased risk of falling. Now, these may seem like some pretty outrageous names like diphenhydramine. What is that? These are things that you may commonly know them as Benadryl, and that's in a lot of the medications you're going to see over the counter. So what I want you to do is go find your favorite pharmacist and have them help you pick out the right medication for you. They're here to help you. Over the years, you may have been prescribed something to help your mood or anxiety, or maybe even just to help you go to sleep. Now, sometimes their effects may have lasted longer than intended, and you wake up feeling dizzy or tired. It's always good to get your medications reevaluated by your doctor to see if you really still need these medications. Have you ever taken a good look at your pill box and said, "Man, I've been taking these for forever"? You may have been taking your medications for so long that you forget why you're even taking them. The more medications you take, your risk increases for having a drug-drug interaction. Even just getting older may cause this to happen. As I was telling you before, these drugs may be staying around in your body longer, and now they might be mingling with other medications that you're taking. So what should you do? At your next doctor visit, or next time you're by the pharmacy, ask about having an annual medication review. Your doctor or pharmacist can take a good look and see if you can be taken off of some of your medications. Have you ever seen the cautionary notice of "Use caution when driving" or "Do not use this medication while operating machinery"? This is said because that medication is known to make people feel lightheaded or dizzy. If you're feeling too dizzy to drive a car, odds are you may be too dizzy to drive your body. Stay cautious about falls and walking.
Sleep hygiene. What is sleep hygiene? So it refers to a series of healthy sleep habits that can improve your ability to fall asleep and stay asleep. What can influence your sleep hygiene? So your daily routines, what you eat, what you drink, the medications you take, and how do you schedule your days and how do you choose to spend your evenings. All of these factors can significantly impact your quality of sleep. So why sleep is so important in preventing falls? Sleep is a risk factor for falling. Lack of sleep causes imbalance impairment, difficulty concentrating, and significantly slowing responses. All of these ones can increase the risk to fall. If you have difficulty sleeping or want to improve your sleep, try one of the following sleep habits for improvement. First habit, stimulus control therapy. So this method helps improve factors conditioned to the mind to resist sleep. For example, you might be cautious at a consistent bedtime and wake time or avoid naps, or use the bed only for sleep and sex, or leave the bathroom if you can go to sleep within 20 minutes, and you have to return only when sleepy. All of these factors and these habits can increase your sleep hygiene. Second method, it's sleep restriction. Lying in bed when you're awake can become a habit that leads to poor sleep. This treatment decreases the time you spend in bed, causing partial sleep deprivation, which makes you more tired the next night. Once your sleep has improved, the bed will gradually increases.
So, to continue on sleep hygiene, let's go on to speak about the breakdown of sleep hygiene. This is a method of therapy which involves changing basic lifestyle habits that influences your sleep, such as smoking or drinking too much caffeine late in the day, drinking too much alcohol, not getting regular exercise, and it also includes tips that will help you sleep better, such as winding down 1 hour or 2 hours before bedtime. Another factor is sleep environment improvement. This offers ways that you can create a comfortable space and environment for sleeping. such as keeping your bedroom quiet, a dark and cool place, not having a TV in your bedroom, or probably turning the TV off, or hiding a clock away from your view. Lastly, there is relaxation training. This method will help calm your mind and body. Approaches to this include meditation, imagery, relaxing your muscles, and other things that you find relaxing that helps you to sleep, helps to think about being calm, cool, and collective.
How many of you have your own personal medication record? What about a medication list on you guys? How often do you guys update that list if you do have one? This is what you should include in your medication list. Name of the medication, dose, how often they take it, and how they take it. Any over-the-counter medications and their frequency, date of any changes made to medications, herbal supplements, and vitamins. So why is this important? This way you can have one master list of all your medications that can be shown to your doctor and your pharmacist. Then the pharmacist can check for interactions between any drugs and over-the-counter medications. This also helps the doctor and the pharmacist to look through all your medications at one time to eliminate any that you may not need to take anymore. Are you experiencing any side effects? Something else to think about when keeping your medication list is writing down any side effects that you may be experiencing. What are some side effects that could cause a fall? Such examples are confusion, blurred or double vision, faint or dizziness, lightheadedness or drowsiness. So what do you do if something you're experiencing may be a side effect of a medication? Actually, how do you know? The problem started when you started taking the medication, or it occurs after you take it. What are some different ways you learn about side effects before you start taking a medication? You should learn about side effects of new medications from your pharmacist. Has anyone ever talked to their pharmacist about side effects? It is important to ask questions. Sometimes it can be difficult to ask your pharmacist or your doctor questions about your health or your medications. What are some questions that are important to ask your doctor and your pharmacist during your appointments? Some examples are, what is your medicine for? What does it do? What results can I expect? What side effects might it have? Will this medicine interact with other medicines that I am taking? How and when do I take it? What can I do to lessen the side effects? Are there things I need to avoid? How long do I need to take it? When should it be stopped? Can I cut my dose of the medicine? Can I get it in an easy open bottle?
It may help to have a regular pharmacist who you feel comfortable with. How many of you know your pharmacist? Having a regular pharmacist, it is important in many ways. Number one, they have all of your medication records stored in one place and they are familiar with you as a person. Number two, they can easily check for medication interactions and they can provide you with recommendations based on your current medications. In the end, pharmacists want you to be healthy and to live comfortably. Here are some tips to keep in mind. Number one, work with your pharmacist to create a routine for your medication that works with your personal daily routine. Number two, never take someone else's medication because they may act very differently in your body. Number three, if you start taking a new medication, get a good understanding of the side effects and take the first dose while you have someone around to monitor you. If you start to notice any alarming side effects, tell your doctor, pharmacist, or nurse right away. Number 4, plan to organize all of your medications for any vacations. Number 5, there are many things you can do to prevent falls. Here are some examples. You can keep your floors uncluttered and be careful of area rugs you have. Stand slowly from a sitting or lying position. Review your medications frequently with your doctor or pharmacist and report any signs of dizziness or lightheadedness. So for next week, I want everyone to create and use your personal medication record and to talk with a pharmacist nearby about some of the things we have discussed today.
Hello, my name is Ahmed. I'm going to talk about the calcium and vitamin D discussion today. So it is advised to all the individuals to obtain an adequate intake of dietary calcium. Providing adequate daily calcium and vitamin D is a safe and inexpensive way to help reduce fracture risk. Vitamin D plays a major role in calcium absorption, bone health, muscle performance, balance, and risk of falling. Further discussion will be made by my colleague further down in the slides about the amount and the dose of the calcium and vitamin D supplements. Here I'll talk about the osteopenia and osteoporosis. Osteopenia is a condition of bone loss that is abnormal but not severe enough for osteoporosis. So there's a test to diagnose the people with osteoporosis or osteopenia. So a test score of -1 to a -2.5 indicates osteopenia, which is abnormal. It's below the normal range. More than -2.5 will indicate osteoporosis. So because bone density is lost gradually with age, osteopenia can turn into osteoporosis over the time. The National Osteoporosis Foundation recommendations for osteoporosis prevention is to get the recommended amount of the calcium and vitamin D. As I mentioned, it will be provided later. Be active, weight bearing, and muscle strengthening exercises. What is osteoporosis? It is a condition in which the bones become fragile and can break easily. The break is typically at the wrist, spine, or hip.
Now that you know what osteoporosis is, you might be wondering, how do you know if you have osteoporosis? You may have osteoporosis if you've had a fracture after the age of 50. Osteoporosis is also called the silent disease, which means you may not know that you have it. It's diagnosed by a test called a bone mineral density test, also known as a BMD test. It's ordered by your physician. Now, who gets a BMD test? It's recommended that it's women over the age of 65 and men over 70 years old. If you've experienced a fracture after the age of 50, and if you're over 50 years old and have some risk factors, which I will explain to you next. So who is at risk for osteoporosis? Women, especially after menopause, individuals with thin and small body frames, Caucasians and Asians, if you have a family history of osteoporosis, people who take or have taken oral steroids for months at a time, this includes prednisone, those who drink too much alcohol, people who smoke, those people who are inactive, and people who do not get enough calcium or vitamin D. However, there are ways that you can strengthen and protect your bones to reduce the risk of having osteoporosis. Number 1, you can avoid smoking. Number 2, you can limit your alcohol intake. According to the National Institutes of Health, they recommend that people over the age of 65 should have no more than 7 drinks in a week and no more than 3 drinks in any one day. Now, 1 drink is equal to one of the following, which you can see on the diagram on the right on the slide, but 1 12-ounce can of bottle of regular beer, ale, or wine cooler, 1 8 or 9 ounce of a can or bottle of malt liquor, 1 5-ounce glass of red or white wine, one 1.5-ounce shot glass of hard liquor, such as spirits like gin, vodka, or whiskey. And if you look at the label on the bottle, it would say 80 proof or less. And lastly, to strengthen your bones, you can do regular weight-bearing exercises, such as walking, hiking, and dancing. Your feet and legs need to support your body and weight when you do these exercises.
After everything we have learned on today's presentation, you might be asking yourself the following question: am I getting enough calcium and vitamin D? Calcium, just like vitamin D, have been proven to be of benefit to strengthen bones and prevent hip fractures. The calcium required daily allowance for women over 50 years of age are 1,200 milligrams. For men, it is the same, 1,200 milligrams per day. However, this is for men above 70 years of age. Some of your calcium sources found in food are some of the following, but not limited to: milk, yogurt, tofu, cheese, almonds, salmon, kale, leafy green vegetables, oranges, and white beans. Some additional sources of calcium are found in products that contain calcium carbonate or calcium citrate. Vitamin D, as we know, is one supplement that helps with balance to prevent falls. The vitamin D required daily allowance varies by advisory boards. The National Osteoporosis Foundation recommends to be in a range of 800 to 1,000 units per day. Some of the food sources that contain vitamin D, again, are but not limited to egg yolks, liver, cod liver oil, salmon, tuna, herring, sardines, oysters, and fortified milk. Another source of vitamin D would be sunlight. The skin makes vitamin D through the action of UVB rays, which is one of the 3 rays that emits from the sun to the earth. On behalf of Notre Dame of Maryland University School of Pharmacy, we show you our gratitude for listening to us over the last couple of minutes. We hope that all of this information will eventually be useful in some way towards your health conditions. We understand that taking all of this information from a couple of minutes, it might be a little bit overwhelming. This is why we encourage you to please reach out to your pharmacist, reach out to your provider. This is what we're here to do, to help you. Stay safe, stay healthy. Once again, thank you.